So we've looked at the recruitment issue within the muscle fibers and the way in which the contraction can take place. Let's go ahead and let's step back a little bit here and look at the bigger picture. And let's look at the concept of the fiber types and motor units, and then the kinematics that take place with contraction. So when we talk about the motor units, what remember is that it's all of the muscle fibers that are controlled by a single motor neuron. The type of motor units that are being recruited is going to be based off of the type of motion that we're looking at, whether it's going to be a gross motor or a fine motor movement, where we tend to see a change of recruitment patterns based off of how dexterous the motion needs to be, where we will recruit rather large motor units when we have to do gross movements. So we'll recruit very few units, but those units will contain a whole bunch of fibers in it. Whereas when we have fine motor movements, we'll be recruiting a whole bunch of motor units, but each one of those motor units will be very small in terms of the number of fibers. When we talk about this recruitment of motor units, what we're talking about is we're talking about the tone of the muscle. This is what is the static level of contraction that we see within the muscle based off of the number of fibers that are being recruited. And this is where we get a misconception that comes into play here. The only way to change tone is to increase the amount of muscle being recruited. And by amount of muscle, I'm talking about the number of motor units being recruited. You cannot increase tone by simply getting larger muscle. You are simply seeing a hypertrophied muscle. You're not seeing an increase of tone. However, when we have contraction forms, we will see an increase or a decrease of tone based off of the contraction form that takes place. The way in which this tone is established is based off of the recruitment of the fibers and how those fibers are able to contract and sustain that contraction. In this, we have distinct types of fibers. We reference them by Roman numeral. The general classes are type 1 and type 2. There are continuums of both type 1 and type 2, looking at somewhere in the neighborhood of about 27 different subtypes within the type 1 and type 2 fibers. Within the type 2 fibers, there are two distinct subsets that you should be aware of. There's the type A and there's the type X. Your book will not reference the type X's. Most books will reference the type B's. The problem is that the type B that human skeletal muscle has is not the type B that is referenced in the books. What the book is referencing as a type B fiber is actually a type X fiber. And so within this type of muscle fiber, we have to look at two characteristics of the fiber itself as it relates to the contraction. Number one is how quickly can it do the contraction, the twitch type. This is whether it is slow or fast, where the slow twitch fiber will hydrolyze ATP at a slower rate than the fast twitch fibers, which means that the myosin head will do its conformational change much slower than the fast twitch. And then the metabolic type. In the metabolic type, we break up. We break up based off of its whether it is oxidative or whether it is anaerobic. In the oxidative, we have two types of oxidative fibers. We have the slow oxidative fiber and we have the fast oxidative fiber. If the fiber is referenced as being oxidative, it's going to have a high amount of mitochondria within it and will be utilizing the mitochondria for ATP return. Since it's utilizing the mitochondria for ATP return, it's going to be utilizing the aerobic pathway, which means it's going to be more efficient, but at a slower rate, which means that in terms of twitch speed, the more oxidative the fiber becomes, the slower that twitch speed will be. Now, within your books, there tends to be a reference of an quote-unquote intermediate twitch, but the problem is that this is a continuum of twitches. The slowest of the slow and the fastest of the fast are the two extremes. Anything in between those two extremes is automatically intermediate. There is no distinct, quote unquote, intermediate fiber twitch. It's either slow or fast. If we look at the skeletal muscle itself in terms of the slow and fast twitching, and in terms of the type of muscle fiber, a normal skeletal muscle is somewhere around 2/3 type 1, 1/3 type 2 in terms of muscle fiber. If we look at the muscle fiber by cross-sectional area, however, the amount of muscle fiber per cross-sectional area of the muscle itself will change based off of training dynamics. The more sustained activity, the more endurance activity that is taken, the more by percent the cross-sectional area will be seen as type 1 fibers. The more resistant anaerobic the muscle is trained, the more type 2 by cross-sectional area the muscle will be. You can change the percent cross-sectional area within the muscle by fiber type, but you cannot change fiber types. There is adaptations that take place within the continuum, but a type 1 fiber will always be a type 1 fiber, and a type 2 fiber will always be a type 2 fiber. A type 1 fiber cannot become a type 2 fiber, and a type 2 fiber cannot become a type 1 fiber. In the overall looking at the twitch and metabolism classifications, we're looking at, with fast twitch, being excessively rapid with their twitches, which means that the cross bridges have to be very rapidly sealed and revealed. There's two issues here. Number one, we have to be able to ensure that enough calcium effluxes out of the sarcoplasmic reticulum, and we have to have a rapid ATP return on that muscle before we reach fatigue. This means that we have to have a very large stimulus in order to get the fast twitch fibers to be recruited. So if you remember back to the continuum of recruitment, the fibers that are harder to recruit will be fast twitch fiber. For my oxidative fibers, I'm going to be relied upon the mitochondria for ATP turnover, which means I have to keep a high density of ATP within the cell itself, and that's going to take up space that the myofibrils would want to take up. The other thing I need to be able to do is I need to be able to have gases diffuse in and out of the cell quite easily. Because of this, the oxidative fibers tend to be much smaller than the glycolytic anaerobic fibers. That's going to diminish the amount of strength that can come out because it's going to change the cross-sectional area components and the total number of fibers, proteins that can be involved within the contraction at any point of time. I've given you notes within the supplemental notes about these various twitch characteristics for the fiber types based on the fiber types. There's a couple things we have to remember before we step into the summaries of these. When we talk about work versus power versus strength and tension, it's about the length of time that the force can be sustained, the time under tension. In this, the oxidative pathways, even though we're going to be using smaller fibers, they're going to be able to work for a greater period of time than the glycolytic because of that, and because of the ease at which they're recruited. The type 1 fibers will be more involved in contractions than the type 2 fibers, regardless of how much tension I need. The type 1 fibers are the oxidative muscles. These are the slow oxidative glycolytic fibers. We have a high amount of myoglobin and a high amount of mitochondria with a huge amount of capillary density around the fascicles. The high amount of myoglobin within the tissue itself gives the tissue a red color. When you eat red meat and you see what everybody calls blood, what you're actually seeing is myoglobin. This is the highest percent fiber being recruited during any activity because it's the easiest to recruit. However, it is the smallest fiber type being recruited. It's going to have the lowest amount of strength. Because the speed of twitch is very slow, it's going to have the least amount of power. But it's able to do the most amount of work. In the type 2 fibers, we have the fast twitch fibers coming in here. These are the lowest percent of fibers being recruited based on the difficulty to be recruited, in which as activity is progressive, we will start recruiting smaller type 2s, followed by medium-sized type 2s, followed by large-sized type 2s, following Henneman's size principle. The first of the type 2s you need to be aware of are the type 2As, or the fast oxidative glycolytics. This is what your book will reference as the quote-unquote intermediate fiber. It is still a very fast twitch. This is the type of fiber that's going to be used when we have a power activity for a prolonged period of time. Go run, go bike. It's the type 2 fibers that are going to get pulled into the recruitment pattern here. There's a moderate amount of myoglobin and there's a moderate amount of mitochondrial density within the fibers. There's a fair amount of vasculature within the connective tissue surrounding the fascicles. They are reliant upon mitochondria. However, they're not as reliant as the type 2Xs and less reliant than the type 1s. Because they have a farther distance of diffusion to take place, they can exhaust themselves based off of backlog within the Krebs cycle, which means that we have about 2 to 5 minutes of window to play before the type 2As start to exhaust themselves due to lack of perfusion, allowing for diffusion of gases in and out of the fibers. The last of the fiber types is the 2Xs. These are the largest of the type 2s and the fastest of the fast twitch. They have the highest power output and the greatest tensile strength. They have the largest cross-sectional area of the fibers that we have. However, they have the least amount of work ability. They will exhaust themselves within 60 seconds following initiation of activity. If they do have mitochondria, but the mitochondria that they have is found strictly around the sarcolemma, particularly near the depolarization spots, in order to allow for the sodium-potassium ATPase to allow for repolarization. There's very little vasculature within the fascicle connective tissue. Most of the vasculature that we see in the 2Xs are towards the epimysium surrounding the bundle of fascicles, as opposed to surrounding and within the fascicle within the perimysium and endomysium. Because there's very little vasculature and because there's very little myoglobin within these tissues tend to be whitish. They're going to be highly reliant upon the creatine phosphate pathway, the phosphagen pathway to regenerate ATP, and glycolysis, lactate metabolism, to regenerate ATP.